It's The Journey with drug and alcohol attorney Mark G. Astor.
All right, everybody, welcome to another edition of The Journey. This is a somewhat unusual show. First of all, we have two guests. I have Dr. Karen Flannery and Dr. Michael Weiner. How are you guys?
Doing well.
Very well, thank you.
So what's unusual about this show is that normally my guests are remote, and I'm in my office with Jay, but this time I'm remote. So I'm actually at the National Association of Addiction Treatment Professionals conference in DC. So this is unusual. So I'm kind of glad I sort of got to share the experience with both of you.
Mm-hmm.
Excellent.
It's good to be here, Mark. Good to be getting to know you.
Yes. And so, what's interesting is that Michael and I met, I think we connected through Facebook, right?
I think so.
Yeah. And so Audra and I, my colleague, my better half, my partner, had lunch with Michael, and he was very gracious and said, "Hey, you got to come up to the Palms." And I then had an opportunity to meet Dr. Karen Flannery, who, it was really a pleasure. I mean, you're both really terrific people, but perhaps more important than that, you're doing some really important work. So I wanted to take the opportunity to share that, through our podcast and let people know what you're doing. So thank you for coming on the show, and also thanks to Jay for hosting you at his home to set this up. So maybe we can start. Karen, tell us a little bit about your background and what you've been doing and now what you're doing with the Palms.
Sure, thank you. I am an internist, so internal medicine by education and training, and have been practicing medicine for the last 18 years at Good Samaritan Medical Center in West Palm Beach, mostly as a hospital-based internist, also known as a hospitalist. And in the past few months, I've made a pretty big career shift. I have been involved in addiction medicine because Good Samaritan has had the Palms Detox unit open for probably about 9 years now, and I was asked to be involved with that and found that I really felt drawn to help people in a different way, I guess, than I had in terms of regular internal medicine practice, and I went back and got board certified some years ago in addiction medicine as well, and so I've gotten away from my longstanding practice as a hospitalist and am working full time in recovery and wellness. So today happens to be, just coincidental, the kickoff for Palm Beach Detox and Wellness Institute. This is our new interdisciplinary team that is providing services in part at the Palms at Good Samaritan. If and when patients require inpatient detox service. It is a concierge level detox unit. It's very small. It's extremely private and discreet. So if patients are referred or decide to come in, then I am there, but also our team, including psychotherapists and a whole host of wellness providers, massage, acupuncture, yoga, Reiki, energy healing, will all help make the patient more comfortable while they're in detox. I also have a full-time recovery and wellness coach, which I'm so excited about. Chris is wonderful. He teaches yoga, he teaches mindfulness and guided meditation, but he also is a sober coach and can help assist people before and after they may need to come into detox. So I'm looking forward to meeting people in their homes, helping them decide their path, their journey, if you will, and then providing transitional care services after they leave detox as well.
It's exciting stuff. Michael, tell us about your background.
My background is I'm trained as a psychologist. Excuse me. I was just telling Karen I have some allergies, so I'll do my best. But I'm a master's level certified addictions professional in Florida. I kind of put together something called lifespan recovery management. And I say kind of put together because it's basically more or less a spirit of the times. It's happening. And it basically means that it's time to start looking at the chronic disorder addiction. We already look at it as a chronic disorder, and we really need to treat it as a chronic disorder. And that doesn't mean we're going to change a lot from what we're doing now. What we're doing now works as well as it can. I think we could make it better by adding sort of another level of care, you might say, which is, let's say a person does withdrawal management, residential care, all levels of outpatient care. But just like diabetics have regular checkups, people like me need regular checkups. What does that mean? Well, I was treated for addiction in 1983, and I haven't seen a professional since that time. My friend, who's a diabetic, is regularly monitored. Would it be helpful for a person like myself to have been regularly monitored? Or I would call them recovery checkups. What that would mean is perhaps semi-annually or annually, I would meet with a professional who would see how I'm doing medically, emotionally, what my risks are, how's my motivation to remain abstinent, and has there been any change in my recovery environment.
Michael, do you think in terms of the way we deal with the substance use and mental health disorders, do you think it's changed at all since back in the 80s when you're dealing with these issues yourself?
Yeah. I'm sorry, say that again?
Do you think, because you've been in recovery, long-term recovery now for many, many years, do you think things, the way that we even sort of look at it and treat folks with these diseases, do you think it's changed?
Well, I think it's changing. Like I said, there are people who have had an impact on me, or people like a friend, Dr. Lewis Baxter in New Jersey, Dr. David May-Lee in California, who's actually the editor of the ASAM criteria, Dr. Michael Botticelli, who was a former head of the Office for National Drug Control Policy.
Hey, Michael, not to interrupt you, but just so you know, I think you might be sitting on a very, very squeaky chair, and I don't want to.
Oh, I'm sorry.
I want people to better hear what you have to say. So just so you're aware of that.
Okay, I'll sit still. If you look at what a person goes through, let's say, to use myself as an example, what do I go through having been in recovery for 30-something years? Well, a few years ago I had surgery. I don't think any person in recovery should go through surgery without having a person like Dr. Karen Flannery on their team. When people go through surgery, it's pretty well recognized that it's a high probability for a risk at that time.
Right.
Having a board-certified addictionologist on the team, well, managing the withdrawal from painkillers is incredibly important. If you look through what a person goes through over the years, people have highs and lows. People have wonderful things happen. People have losses. It's hard to get through. So let's say something really terrible happened to a person. Maybe they lost somebody very close to them, and it's time for their recovery checkup. Wouldn't that be a great time for a professional to suggest the person goes through some grief counseling? Could that stop a recurrence of active symptoms? Yeah, I'm certain that it can. So that's the general direction I think we need to go. And I think we need to stop saying, I've been to treatment once, I've been to treatment 3 times. A person who has diabetes hasn't been to treatment 3 times. It's an ongoing care.
Right. It seems like the people that are successful in long-term recovery continue to work at it. I mean, obviously, I've got a lot of friends like you in the treatment industry, and they seem like they are, they're going to meetings, they're working with their sponsor, whatever it is. They're actively. They don't just go to treatment and they're like, oh, I'm done. I'm good. It doesn't seem to work that way. I mean, it's a bit like cancer. I mean, if you go into remission, you don't suddenly go back to smoking cigarettes, drinking, a bottle of wine every day and eating McDonald's every day and say, oh, well, I don't need to, I don't take care of myself. I'm in remission. You got to work at it or it comes back.
But, Alcoholics Anonymous has done wonderful things for people. But nobody's saying that a person with diabetes has to rely on a mutual support group to stay well. People with diabetes do have mutual support groups, but they also have regular professional monitoring and follow-up. And I think people with addiction, we deserve the same.
Yeah. Karen, I want to ask you, because, one of the things I've learned the last 4 years in working within our industry is, I think that the common perception is, and I get this from parents all the time when they call us, is, at least from one parent, they say, well, why doesn't, little Johnny stop, or why doesn't little Jane stop? And I say, well, the science indicates it's a brain disease. And I'm wondering how well received that has been by the medical profession, because I think you're an unusual doctor to work in this. And I love that about you. When I first met you, I was so impressed. So, I mean, how do you think that the medical profession as a general rule sort of receives, the whole idea or whole notion that we're dealing with a disease and not just, a bad choice?
Thank you. I pride myself on being unusual.
That's good.
I think we as a medical profession are coming along. I know that there's still not quite the comfort level. For example, psychiatrists have historically been the ones to be the go-to addictionologists, if you will. But internal medicine doctors, family practice doctors, primary care physicians really are so instrumental in getting patients to the treatment that they need or guiding them in a path. But I think that in the traditional education and training pathways for primary care physicians, perhaps there, at least when I was training some years ago, there wasn't a great deal of focus, or didn't provide us direction maybe on how to assist our patients, and therefore didn't give us a comfort level to be able to speak about this topic professionally, if you will, as a medical doctor. And so, one of the things that I'd like to do with Palm Beach Detox and Wellness Institute is to get out into the community, into the medical profession in our community, and also to lay people in the community to provide education, to help with Dr. Weiner's support. He's taught me a great deal about the language that we can begin to implement and share with others in terms of destigmatizing addiction, substance use disorders, and really to help everyone, physicians and individuals suffering from addiction and their loved ones, to not have sort of the traditional shaming type language and approach, and hiding it and being deceptive. That's all part of the disease, but it's because it hasn't been treated as openly as we would treat some other kind of condition like diabetes. So we're getting there.
I think it's ironic what you're both doing together, is because, there's been quite a lot of, I can see a finger pointing at, the psychiatry field and the medical field, the doctors with the painkillers and the psychiatrists with, the ADD medication, things of that nature. And so I think it's what's really, I guess, ironic or cool is that you guys are working together to come up with a solution. I love it. I think it's great.
Very exciting. Thank you.
Very exciting.
It's interesting. I think people like myself, we've often said that physicians really need to learn more about addiction. Well, I think, like Dr. Flannery mentioned, language changes. The language we have been using is not the same type of language that physicians generally use. Physicians don't use the word aftercare. It's kind of not relevant. Physicians don't use shaming language. When you're treating a chronic disorder, physicians don't basically say treatment 1, treatment 2, treatment 3. So I think we're going in the right direction, and it is nice to work with a physician. We just have a lot of common agreements. It just feels good.
Yeah, Karen, in the beginning you talked about your certification. Tell me about that, because I know that you're a board certified internist, but you said something like you went back and got another board certification.
Board certification in addiction medicine. This actually is, I love talking
about this. I never heard of a doctor who has that certification. I didn't even realize there was one.
Yeah, I guess you could say I sort of got grandfathered, and the track going forward is physicians would choose specifically a training path. Like we all go to medical school for 4 years, and then you choose internal medicine, family medicine, psychiatry, and then some do additionally a fellowship in something like cardiology. So that is really what's hopefully going to fuel the growth of a whole new generation of addictionologists. But I guess I'm officially a dinosaur now, and so I did get grandfathered in. I certainly had to study and take the same tests that everybody has to take, but I didn't. I sort of got to do on-the-job training, if you will, and that was excellent. But it was very humbling. I didn't know what I didn't know until I really sat down to explore this field, and that was just such an honor to be able to open my mind up after a number of years in practice, thinking that I kind of knew it all. And I still learn every day from other professionals that I surround myself with, and patients teach me things every day. But it was cool taking that test. If say a cardiologist and you go to take a board exam, you're in a room with a bunch of other cardiologists, a psychiatrist, a bunch of psychiatrists. In this case, I knew a lot of the physicians in town. We all had studied and gotten grandfathered to sit for this test. But in one room, taking the same test, was myself, an internist.
Karen, hold on 1 second, Jason. I think I lost the visual on. Jason, can you hear me?
Low battery, it says.
Yeah, I lost the visual. Oh, there we go. Okay, you guys are back. All right.
It's charging.
Thank you. Yeah, go ahead. We could hear you. Just couldn't hear you.
Okay. So anyway, I was just going to say, in the room, all the physicians taking the same board exam for addiction medicine was myself, an internist, primary care, family medicine. We had an anesthesiologist, a neurologist, a psychiatrist, a occupational medicine specialist, physiatrist. And so I think what's so exciting about that is that it's not only what it's doing for the field of addiction medicine and putting addiction medicine sort of on the map as its own specialty, but it's really breaking down silos, right? So all of these individual specialists have just practiced their level of expertise in what they know, and a patient needs to go to this specialist for this and another one for that, and this is really kind of opening all of our minds professionally to glean from each other perhaps what we learned way back in our original training, and this is sort of a secondary professional pathway for us. So it's just, the opportunities are endless.
Yeah, it's interesting because I don't know if I've met another doctor or heard of a doctor actually sort of involved in the treatment of a substance use disorder. I mean, typically somebody goes to a treatment center, and even the really good ones, I mean, I believe they're legally required to have a medical director on staff, but I don't know if that medical director is actively involved in treating patients or setting up the protocol. So this is very different. I really like it. I think it's progressive. How's that? See, you're progressive, Karen.
Progressive. Thank you. And I'm passionate about it. Thank you for acknowledging.
Mark,
go ahead, Michael. Sorry.
If a person would, go online and just put in www.abam.net, that'll get you to the website for the American Board of Addictions Medicine, and then you can click on Find a Doctor. And people would be surprised how many board-certified physicians there are in their community. But it's an interesting thing to do. So I recommend it.
Yeah. So Michael, tell us a little bit about lifespan recovery and what you do there.
Lifespan recovery, I've already talked about a part of it. If you have a chronic disorder, you need to be treated like other people who have a chronic disorder. In other words, a person like myself I would benefit from a semi-annual or annual recovery checkup.
So are you working with families, or are you working with families that are sort of in that post-treatment, time?
When you say post-treatment, what?
So somebody's been through 90 days of perhaps residential PHP and IOP. Is that when they come to you? Tell me how lifespan.
Well, I actually also have a private practice. People come to me often when they're struggling with recovery. It helps a lot when people get to look at addiction as a chronic disorder. For example, let's say a person comes to me and they say, I've been to treatment 4 times. What that person is saying to me is, I've failed 4 times. That's the connotation. I might say to that person, well, you really haven't failed 4 times. I might ask them, when was the first time you walked into a treatment facility? They might say it was 8 years ago. And I might say to them, that's when your disorder was diagnosed and you started your recovery. I might say to them that, when you left that residential center, maybe a better job could have been done on helping you plan for the rest of your recovery, or helping you plan continued outpatient care, or maybe you could have done a better job of following it. But basically what happened, you may have stayed abstinent for a while. You may have done something like wondered whether or not you could drink socially. So you experimented, but your symptoms came back full blown. And that's when you needed a higher level of care again. So you went back to the hospital, namely residential care. You haven't been to treatment 4 times. You've been to the hospital 4 times. It's like a diabetic who's had 4 flare-ups of type 1 diabetes, and they've had to go to the hospital 4 times. In between those 4 times, they're monitored. Usually when they get out of a hospital, they do intensive outpatient treatment. They don't call it that, but they see a physician often. When things go well, they don't see a physician very often at all, but things are monitored. If symptoms change, symptoms always indicate the need for the level of care. If a person, let's say, has a substance use disorder, they've been abstinent for 8 years, they pick up over a weekend, the symptoms may not indicate a need to go to the highest level of care. You look at the symptoms, it might say, okay, maybe you need to go back into some outpatient care to get stable. I think I'm describing how you treat most chronic disorders. Have I?
I was actually just thinking, it sounds like you're saying my part, and I'm thinking I'm thinking your part. So he's the psychologist. As the medical doctor, that's what I have done or did, for so many years in my career, is kind of put out fires, right? Treat acute exacerbations of chronic diseases predominantly. And I think that the other thing, maybe that if I can expand upon this idea a little bit, is recognizing that if we give him that this is a chronic, lifelong illness that will have flares or exacerbations, as we call it in medical terms, from time to time, we can't always, but we can generally kind of predict or have a pretty good idea when an exacerbation might be sort of lurking nearby, right? And we know common stressors, big things, life changes, end of relationships, grieving and loss of a loved one, financial hardships. Those are times when we have a little bit of advanced warning. Hey, maybe I should hook back up with my addiction medicine professional so that I can not go down the path where I found myself before. I'm aware, I'm self-aware, I'm mindful of the condition that I'm in right now, and I know what has happened to me in the past. Let me learn from that. And I think one of the great things about lifespan recovery's sort of approach is that it really doesn't ever talk about failure and we really try to get away from the term relapse, but it's just sort of life, right? And there's going to be ups and downs, and acknowledging that there are going to be downs. Well, let's stay a step ahead of them if we can. Let's kind of, pull you back from the edge a little sooner than we might have otherwise. But in order to be able to do that successfully, I think we need to have the right non-shaming language and the right healthcare professionals to be able to welcome someone in and say, are you going down that path? But the other part of that, and this is probably more relating or more intensively relating to those that are just coming out of an acute exacerbation, if you will, coming out of detox and maybe a residential treatment center, intensive outpatient treatment. And that's really instilling some, helping someone on a path of self-discovery, right? And helping them to find their own path toward enhanced self-care and personal empowerment. And
Jason, sorry guys, sorry to interrupt Karen. Jason, we lost a bit.
Let's just keep saying low battery.
There we go, you're back. Okay.
And I think, the other thing I'll say about that is, much like my career in internal medicine, where, we really treated, as a hospital-based internist, treated acute exacerbations of chronic illnesses, I think it speaks to healthcare, perhaps in our country or in Western medicine overall, is that, and even if you look, I don't want to get too political, but even if you look at where we spend our healthcare dollars, right? It's in fighting disease, right? It's treating acute exacerbations of conditions. And boy, what we could do if we put some of those resources into wellness, right? Self-care, self-improvement, self-discovery, and embracing things like mindfulness. Guess what? That's free, right?
Yeah,
but you have to have professionals to teach and bring you to it.
I mean, we call it healthcare, right? But is it really healthcare or is it sick care?
No, it's disease. No, it's disease care.
The person before they get sick.
Yes, yes. So wellness promotion and disease prevention.
Karen, I want to know, how did you get so passionate about this topic? Because I think that in order to work with individuals who are dealing with these issues, you got to be passionate about it. And I know I can just, the first time I met you, I said, wow, she's really passionate about it, which is unusual for a doctor to be passionate about something like this. It's so unusual.
Well, to be honest, I think I like a good challenge. The patients that I've seen in just, to date or up until recently, being only in an acute detox environment, as much as I love taking care of complex, acutely ill medical patients, I felt like the patients that came through the detox unit, they would kind of like do well in detox and, we'd manage their withdrawal symptoms. And then I just use the term, they sort of fall off the cliff. Folks that come to a detox only facility come there because they're not really interested in going to a 30-day residential treatment program. They've been there, done that. They think it didn't work for them, or, they've relapsed and shame on them. They can't go back. And there's got to be another way, but they haven't figured it out. And for all these years that I've been doing this sort of, part-time until now, I hadn't figured it out. I felt like I was missing something. There was more. And I needed to help those who struggled and didn't really know where to turn. And it's not to say that they couldn't, again, benefit from going back into the system, if you will, into residential treatment or, an IOP. I think by having sort of a concierge level practice where we have a whole team of wellness and recovery providers and addiction medicine specialists that rally around one person and create a strategy, work with them to create their own personal journey in recovery, and then follow them if it means holding them accountable for for showing up for appointments, to going to meetings, to doing the work and the self-empowerment, but in a turning sort of the shaming aspect of it on its head and lifting them up, right? And sharing in their self-compassion and the pride that they should take in what they're embarking on in their journey. It's tough. There's no easy answer, and I do like a good challenge. So I think I've got my work cut out for me. But I hope to do this just a bit differently for the sake of those who have trusted me with their care over the last several years.
Well, so before we wrap up, I want to ask you each a question. Michael, where do you see, in terms of the way we help people who are dealing with the disease, where do you see things going from here? Because obviously we're in the middle of a national epidemic here and we're losing kids left and right. So
by national epidemic, you're talking about the opioid crisis?
I guess that's how I would refer to it.
Well, actually, that's turning into a stimulant crisis. But you know something? I read about people coming up with solutions. I read about people coming up with some very creative, interesting, and effective interventions. Whenever I see that, I feel in my gut that if you don't monitor this disease, this disorder over the course of a lifetime, you're wasting your time. And if you ask yourself the question, let's say you take other disorders, other chronic disorders, diabetes, hypertension, What happens when a diabetic stops treating their disease? They get sick. Their symptoms reoccur. Why would you think a person with substance use disorders would be any different? Treatment stops, symptoms reoccur. So I think we're going in that direction. I think another way that we connected, there's a good number of people who come to the Palms who are local. We have the ability to recovery manage that person forever. So that's where I think we're starting, I guess you could say.
I'm getting there.
Karen,
Gotta
what
start
about you?
somewhere.
Karen, from a doctor's perspective, where do you see things going?
I hope that more people will be able to embrace the language change that not just we, but I know ASAM is looking to promote, to destigmatize both substance use disorders and other mental health conditions, or any mental health conditions, because that's really where the crisis is. People are drinking or using drugs to self-medicate because they are ashamed and they don't know what to say, or they've been put down and told that they're not worthy, and maybe as a result of this sort of downward spiral, they've either lost their healthcare coverage or their own personal wealth that they've accumulated over the years, and they are not able to pay for their care, or don't even recognize that it could be treated as a medical condition, and so they just really find themselves in this downward spiral and turn to drugs or alcohol just to numb it, just to take the pain away. And I think that if our medical profession and with regard to healthcare coverage can give them permission to seek help, seek treatment early and often, and if we can pay for it, and devote more of our funding in healthcare to disease prevention or prevention of exacerbations of chronic diseases, which we now know that addiction is, then I think we'll have come a long way.
I love it. I love the combination of both of you working together. It's really inspiring. So, how do folks who are going to watch the show, how do they get a hold of either one of you or both of you, or find out more about the program that you're running up in West Palm? Michael. Actually, I should say Karen.
We work together. My phone number 561-398-8696. My website, www.lifespanrecovery.net. If by any chance they're looking for Dr. Flannery but can't find her, they can call me. I'll get them there. I'm sure Dr. Flannery would do the same for me.
Absolutely. My phone's always on. My personal cell, 561-818-4778. And we will be live with our website, Palm Beach Detox and Wellness Institute. The abbreviated website is pbdwi.com, but it should be live hopefully by the end of the week. So check back on that.
I love it. All right, I'm going to give out my information, but don't go anywhere, okay? All right, folks. So I hope that you got something out of the show. It's unusual to have two just really amazing guests, and I'm very grateful and humbled that you both spent some time with me. And by the way, I enjoyed, Audra and I had really enjoyed spending some time with you guys. So I want you, Michael, we got to take Karen to our favorite restaurant. You know that, right? We're making that happen. Michael, I introduced Michael to Farmer's Table in Boca, and he's now, I hate to use the word addicted, but in this framework, but the food is very good there. We'll leave it at that. So for the folks who want to get a hold of me, or just get a hold of me so they can get a hold of either Michael or Karen, they can find us on the web at drugandalcoholattorneys.com. They can email me, mark@drugandalcoholattorneys.com. They can call us, 561-419-6095. They can find me or the Drug and Alcohol Attorneys Facebook page on Facebook, LinkedIn. I think I'm now tweeting pretty regularly. And I've been dragged into the 21st century. I know we're also on Instagram. And thank you very much, both of you, for not just coming on the show, but more importantly, the work that you're doing. It's really, it's very inspirational, and you're making a big difference, and that's really what it's all about when you work in this industry. So thank you very, very much.
And you as well. Thank you.